My lady, good afternoon. Can you see and hear me?
I can, thank you.
Thank you very much. The next witness is Charlie Taylor, who's giving evidence on behalf of His Majesty's Inspectorate of Prisons. Please may he be sworn.
I swear by Almighty God.
I swear by Almighty God
That the evidence I shall give.
that the evidence I shall give
Shall be the truth.
shall be the truth, the whole truth, and nothing but the truth. Thank you.
Thank you. Will you give us your full name, please?
My name's Charlie Taylor, His Majesty's Chief Inspector of Prisons.
Thank you very much. Now, Mr. Taylor, you should have before you a copy of your witness statement, which you've provided to us on behalf of His Majesty's Inspectorate of Prisons, and it bears our reference number INQ 000659848. Please, can you confirm that that is the statement that you've provided to us?
Yes, I can.
And that the facts stated within it are true to the best of your knowledge and belief?
Indeed.
Thank you very much. The Inspectorate of Prisons serves as an independent inspectorate, scrutinising the conditions and treatment of prisoners and other detainees and reporting its findings. Is that right?
Yes, indeed.
It helps to ensure that detention is humane, safe, respectful, and helps to prepare people for release ahead of their return to the community.
Indeed.
And it does this by carrying out independent inspections of prisons, young offender institutions, secure training centres and court custody facilities across England and Wales, and also immigration detention across the UK. Is that right?
That's right.
Thank you. Is it tasked with scrutinising the conditions in which all of those people are kept during the periods of their incarceration?
Yes, in effect, the exam question we have at every place we inspect is, what's it like to be a detainee in this institution?
Right. And once those findings have been obtained from the inspections, are they, in fact, carried out in accordance with published criteria, which are known as expectations?
That's correct.
And are they then set out in a series of reports? And is the reporting part of the duty of the inspectorate?
Yes, it is indeed.
Thank you very much. Does the inspection, when it takes place, involve the collection and review of both qualitative and quantitative data in order for the inspectorate to be able to understand what's happening in each of the establishments that are being inspected?
Yes, indeed.
Thank you. And are there 5 key sources of evidence relied on during inspections? Those being, first, observation; second, detainees, so that includes qualitative feedback in the form of interviews or data collected; third, staff who are spoken to during the course of the inspections; fourth, relevant third parties; and fifth, documentation including, for instance, Home Office data sets. Now, Mr. Taylor, the benefit of giving evidence after others who have helped the inquiry on the issue of prisons and detention is that the inquiry has heard a lot of what you have very helpfully contained within your witness statement, and therefore there are some topics which I can deal with very lightly and others that I can cross off completely and don't need to trouble you with. But it's right that your witness statement has already been utilised this morning in me being able to put the content of it to other witnesses. So please don't think that it's been a wasted effort. And of course, my lady has the very full witness statement from Mr. Taylor to reflect upon following the public hearings. I'd like to begin your questions by looking at some aspects of the impact of lockdown and regime restrictions as they fell upon the inspectorate, and in particular to ask you about the imposition first of short scrutiny visits and then scrutiny visits during the pandemic. Can you explain to us, please, how your process of inspection had to alter once the pandemic hit?
Yes, so we stopped inspecting on the 17th of March. Then obviously the full lockdowns came in on the 23rd of March. My predecessor, Peter Clark, very quickly had conversations with the prison service about continuing to go into prisons and continuing to report because of ours and the prison service's concerns that it's important that prisons continue to be scrutiny and that the public knew what was going on within prisons during the lockdowns. And so by the 14th of April, we were back in HMP Bullingdon, beginning to trial what we called short scrutiny visits.
What were they?
So these were a lighter touch visit that was much shorter in time than our usual visits. And rather than us reporting directly on individual prisons, we brigaded together the findings from 3 prisons and put out a very brief report. Right. So that was the short scrutiny visits. We then went in July that year to what we called scrutiny visits, negotiated with the prison service, whereby as lockdown restrictions began to be lifted in the community, we felt that we could extend the depth of our scrutiny. So rather than brigading the findings of 3 prisons together, we did a more extended methodology that we developed during that time, so that we were able to do a short prisoner survey, an adapted prisoner survey, and also to spend longer in each individual prison to dig a bit deeper into the sorts of things that we look at.
Thank you very much. And what about immigration detention, the immigration removal centres? Were those places also subject to the same?
Yes, we followed the same process with them.
Thank you. The inquiry has heard this morning about the early release scheme that was devised, but only took effect to a very limited extent. Looking at the issue through an inspection lens rather than a political one, how would you characterise the state of the prisons at the time that the early release scheme was paused, including population pressure and prisoner well-being?
So in the early days of the pandemic, what we saw was the prisoner population fell to some extent. And that did provide some breathing space for prisons, that they weren't quite as overcrowded as they have been.
Yes.
But that isn't to say they weren't, many of them, substantially continuing to be overcrowded. It just took the pressure off a bit. But as the pandemic continued, what we then began to see were the number of remand cases increasing within prisons because people were waiting longer and longer for trials to get on.
And the inquiry also heard this morning that at the other end of a prisoner's sentence, it was becoming more and more difficult to comply with the sentence plan in order to then be either released or be paroled.
Yes, certainly. So, for example, some of the interventions that were on prisoners' sentence plans, some of the accredited programmes that they were supposed to complete in order that they could impress on the parole board that they had reduced their risk, were unavailable in lots of prisons. So that was a big cause of frustration amongst prisoners because they weren't able to demonstrate either to officers or to the parole board that actually their risk had reduced and they could reasonably be either moved to open conditions or released from jail entirely.
And so was the direct impact of that they weren't moved and they weren't released?
So what we saw were prisoners getting stuck within the system, sometimes for longer periods of time. The whole system just slowed up, both at the front end and at the back end.
Thank you. Do you have a view on whether it would have been beneficial for the situation in prisons if the early release scheme had either continued or in fact been implemented in a different way than it was?
Well, I think from the Inspectorate's point of view, anything that reduces the levels of overcrowding within prisons is always beneficial. And we've seen over the last few years there have been lots of attempts to try and reduce the prison population. And even where they stop the population from falling over, where the danger of running out of spaces is mitigated, we still continue to see prisons that are far too overcrowded, particularly the crumbling Victorian reception prisons in our inner cities that are often the least well equipped to be able to manage an extended population.
Yes, and we're going to look at a plan of one of those prison cells in a moment. Before we do, I'd just like to ask you about social distancing and overcrowding. At paragraph 108 in your statement, you tell us that social distancing was difficult in parts of many prisons because of the design of the building, and particularly difficult to achieve in overcrowded Victorian prisons, such as Wandsworth, that has narrow prison landings, and the design of it is not conducive to something like social distancing.
Yes, that's right. In a jail like Wandsworth, you have the ground floor, which is open, and then the rest of it is in effect balconies. So the balconies are very narrow, and therefore for prisoners to pass each other, they're getting very close in very close proximities. I mean, it's barely the width of this desk.
The inquiry has also heard this morning about the length of time that prisoners during the pandemic were locked in their cells, between 22 and 23 hours a day. Is it fair to say that the prolonged confinement of prisoners in their cells for that number of hours, often for months at a time, was driven in at least in part by the practical difficulty of maintaining social distancing and infection control in overcrowded prisons?
Yes, certainly that was the case. And I think even 23 hours in some prisons was a conservative estimate. We saw prisoners locked up for more than 23 hours a day in some of particularly the earlier short scrutiny visits that we did. So that was the part of the reason were concerns over social distancing, and also the difficulties with creating, in effect, cohorts of prisoners who could then operate and live together, could get out, get their food, get back into their cells. But what we saw really was just the processing of prisoners through the day. So getting them out to get their food, getting them out to have a shower, getting them out to make a phone call if they didn't have in-cell telephony at the time, and getting them out to a bit of fresh air. That was often, even that, prisoners were struggling to manage such a meagre regime.
Would you agree that clinically vulnerable prisoners would have been particularly impacted by overcrowded prisons because it limited their ability to reduce exposure and increased their risk of suffering severe outcomes from COVID-19?
Yes, certainly, and that was one of the concerns that we flagged frequently in our reports.
Thank you. Looking at immigration detention for a moment, had all the immigration removal centres been operating with populations well below their capacity in the run-up to the onset of the pandemic?
Yes, they had, and during the pandemic, more detainees were bailed as well. So the overall numbers of detainees in immigration removal centres was reduced, and some of the pressures that we saw in prisons certainly weren't as severe in immigration removal centres.
Thank you. And so in terms of insight and analysis of longer-term effects of the COVID pandemic, you tell us at paragraph 129 that since the end of the pandemic, the number of people in prison on remand continues to rise, with the latest official statistics that you provide to us in your statement suggesting that as of June of last year, it was 17,701 prisoners. That's just prisoners on remand.
Indeed.
So waiting for their cases to be heard. You also say at paragraph 130 that another development post-COVID has been a rise in the recall prison population.
Indeed.
Can you explain to us what that is, please?
Yes, so prisoners are released from jail on licence. Traditionally, that was 50% of their sentence. It's then changed to 40%, and in the Sentencing Act that's just been passed, it will become 30% of their sentence.
Yeah.
So once they've served whatever time the court has said they need to serve, they're then released on licence. if they breach their licence conditions, so that doesn't necessarily mean they commit a further offence.
No.
But if, for example, they don't turn up at a probation appointment or fail to stick to some of the rules that they've been given, then they may get pulled into custody. Also, if they are accused or are deemed to have committed a further offence, then that may also be grounds for them being returned to custody on the judgment of the probation staff.
And you tell us that as of June of last year, so at the same point in time, the recall prison population was 13,538 prisoners, which was 11% higher than 12 months previously. Is that right?
Indeed.
Yeah. Let's look now, please, at the impact on prisoners and those detained. And we'll look at several impacts here. The first one is that, as you've said, despite long-standing challenges in the provision of sufficient time out of cells and purposeful activity in many establishments, there had never been in recent history a time when the entire population had such little time unlocked than during the pandemic. The inquiry heard this morning about the effect upon prisoners of the removal of the facility to exercise and how that affected their mental health. You've told us, though, of some changes that were implemented to the system to encourage and enable in-cell exercise. What were those?
So we saw some quite impressive PE teams within prisons working out some in-cell exercises that prisoners could do. And we also saw the introduction, particularly in the very good weather in the pandemic, of some exercise equipment going out onto exercise yards as well that prisoners could use. But it's worth remembering, if you are in a standard 12 by 6 cell shared with another prisoner, the actual space to be able to do any exercise is extremely limited.
Well, that brings me to the physical manifestation of what prisoners were often being expected to cope with. And let's have a look, please, at an illustration of a Victorian-type cell, which is at 000469662. And it's, in fact, let's just pause on this page, please, because it's going to come up again. This was a report prepared by the Inspectorate of Prisons, What Happens to Prisoners in a Pandemic, which we can see as a thematic review, and it's dated February of 2021. And then let's go, please, to page 13 and have a look at the description. And can we highlight, please, the two-scale plan? So this is a cell which is designed for one.
Indeed.
But we can see at the top that it can be doubled up to accommodate 2 prisoners. How would this cell be altered to accommodate an extra person?
So it would simply be bunk beds. So
Right.
the same size bed, but you'd have another one on top.
And we can see that in terms of the ability to perform very much physical activity in that space, it's really negligible.
It's extremely limited.
Yeah. And did your inspections during the pandemic reveal that many of this type of Victorian cell was being inhabited by 2 prisoners?
Yes, we frequently came across, as we still do, cells that were originally designed for 1 person with 2 prisoners in them. And actually, the cell that we were rather generous in the picture we put in of a cell here, because, for example, there are 2 chairs in this picture, but often we find there's only 1 chair. Sometimes there isn't a wardrobe, or the wardrobe is not in good nick. And also, in this case, there is at least a privacy screen in front of the lavatory. But in some jails we go to, there may or may not be a curtain in place. And also that this lavatory was in the corner. But if you go to a prison like Brixton, the lavatory is actually roughly where the higher up of the 2 wardrobes is. So really, it's virtually in the centre of the room.
Thank you. And I just want to bring myself back to the scrutiny visits, because I remind myself that during the Justice Roundtable event and in the Justice Roundtable report, I think there's reference to the fact that your visits, or the visits of your inspectorate during the pandemic, were, at least for some period of time, remote, in the sense that you were interviewing people or speaking to people remotely rather than going into prisons. That needs to be corrected, doesn't it?
Yes, that's right. The Inspectorate were in prisons from the 14th of April, and we didn't stop being in prisons from then onwards.
No, thank you. And reminding ourselves that immigration detention is, as you say, paragraph 165, not intended to be punitive or carceral. What sort of conditions were you seeing in immigration removal centres in terms of the manner in which people were being housed during the pandemic? Was it an improvement to what we've just seen? Yes,
so by and large, things were much better in immigration removal centres. So fewer restrictions on people locked in their rooms. That generally there was reasonable amounts of free flow. The numbers were much, much lower, so there weren't that many people there. But also most detainees were held in, or almost all detainees were held in single cell accommodation as well. So again, that meant there was more space. So the overall pressure on detainees was probably lower from at least an overcrowding point of view, and the daily regime was more open than we were seeing in prisons.
Thank you. In prisons and in the immigration removal centres, did the Inspectorate consider whether shielding units and the resulting reduced time out of a cell had placed clinically vulnerable prisoners at a particular disadvantage when compared with the general prison population?
Well, what you have in prison, in terms of the clinical vulnerable population, is both prisoners with ongoing, sometimes chronic health difficulties, but also there's an ageing population of just particularly some very elderly men and a small handful of elderly women in prison as well. In some jails, what we saw was some quite impressive arrangements to make sure that cohorting was done really tightly. But as we said at the beginning of this, actually in some jails it's just really hard to do because of the nature and design of those particularly older Victorian jails.
Thank you. I want to turn now to discuss the access to healthcare and how that may have been restricted during the pandemic. And the inquiry has heard this morning a significant amount of evidence on this topic. So I only need to take you to 3 discrete areas, please. And in doing so, could we have a look at 3 short paragraphs of your witness statement, starting at paragraph 218, which deals with secondary care. I'm afraid I don't have the I&Q number, but I know that it's paragraph 218. It's 000659848. Thank you very much. You say here, prisoners faced additional barriers in accessing secondary care relative to the general population because their access is dependent on the availability of prison staff to escort them from prison to hospital. This isn't something that we really covered this morning, but of course, once the system begins to close down because staff are ill themselves or don't have the availability to transport a prisoner from prison to hospital, or the appointment has to be cancelled for some reason. What then happens? Does that in itself cause a logjam in terms of the ability of that particular prisoner to access the medical care? Yes,
and it was a risk that we highlighted throughout the pandemic was the fact that if people weren't able to get to appointments for secondary care, the danger was that things were going to get worse and what had been a more treatable condition was going to become harder to treat over time.
Thank you. Another aspect of the restrictive regime was substance misuse support. So at paragraph 225, you tell us that the demand for illicit drugs did not disappear during the pandemic, and prisoners told you that one of the ways many relied on to pass the time was the use of drugs. The Inspectorate Prisons Thematic Review at paragraph 91 says that prisoners were clear that illicit drugs had continued to come into prisons, although in more limited quantities. And in the 2021 to 2022 annual reporting period, almost a quarter of prisoners told the Inspectorate of Prisons that it was easy to obtain illicit drugs despite the restricted regimes. Is that right?
Indeed, indeed.
Yeah. Just pausing there, what was the thematic review that you refer to there? Is that the review that we've already looked at?
Yes, what happened to prisoners during a pandemic. Yeah.
Thanks. And then finally, social care at paragraph 229. You say that local authorities have a statutory responsibility to provide social care to those in prison, which mirrors that in the community. When restrictions were introduced, this support was largely sustained where care packages were already in place, but assessments for new referrals were affected because many local authorities withdrew face-to-face assessments and delayed those by telephone, which reduced the quality of the outcomes. Although the Inspectorate of Prisons found a few positive examples of provision for older prisoners and those with mobility issues, some prisoners had been left in degrading circumstances in some prisons. At Earlstoke, Northumberland and Pentonville, for example, prisons, is that scrutiny visits?
Yes.
Found a lack of support for prisoners with mobility issues, had left them unable to clean themselves or their cells or access the shower. And at Earlstoke, this included one disabled man who had to pay other prisoners to clean his cell. He didn't have a bed rail to prevent him from falling out of bed or suitable shower or toilet adaptations. And at Bristol, by contrast, the Prisons Inspectorate found an annex had been developed for older prisoners and those with mobility impairments, which afforded a safe environment for prisoners to live and shield with no unnecessary restrictions. So do we see there that experience of prisoners in different prisons was wildly different?
Yes, indeed. And I think what we saw at Bristol really was to do with an innovative and very effective leadership team there who were determined to provide as open a regime as they could whilst fitting in with the restrictions. Well, elsewhere, as we've highlighted here, we saw some very concerning findings about some really vulnerable men and women not getting the support that they needed and being left in conditions that were simply inhumane.
Thank you. We can take that down, please. And could we now display the report from the Centre for Mental Health, which is entitled Future of Prison Mental Health Care in England? It's at INQ 000649021. And we can see that this is a report which resulted from a national consultation and review. And could we have a look, please, at the part on, I think it's page 27, thank you very much, and highlight the right-hand side of the page, thank you, just to reflect upon deaf prisoners. And submissions of evidence on deaf people in prison illustrate the difficulty that all services in prison appear to have in tailoring care to individuals with less common needs. It is not clear exactly how many people in prison are deaf. The British Deaf Association in 2016 reported that approximately 400 people had self-disclosed hearing loss or some form of deafness, but state this is an underreporting of the numbers. In this report, we are describing issues for deaf people in prison as opposed to those with hearing loss. Prisoners with hearing loss are likely to be a much larger group than those who identify as deaf, but will also be disadvantaged. Marked isolation coupled with communication deprivation is the general experience of deaf people in prison. Only a minority of prison staff have training in British Sign Language, and British Sign Language interpreters are not routinely provided. Deaf prisoners may have no greater literacy levels than the average prisoner, which are often low, and therefore written communication may also be difficult. This inhibits their ability to take part in almost any activity, such as work or education. It also impedes health and mental health assessments and what can be offered in the way of intervention. We were provided with one case study of a person who spent virtually, we just need to go to the next page, thank you, no time out of their cell because they did not know that the cell had been unlocked. Most people would know due to the noise made, and often only finding out when they were told it was due for locking. Prison officers and other staff are very unlikely to have any training or knowledge in managing and supporting deaf prisoners. And then it goes on to talk about a consultant forensic psychiatrist for the deaf who reported what they had experienced. I only highlight that to ask whether or not the regimes that were implemented during the course of the pandemic would have also affected those most vulnerable in prisons and would have made their period of time and their experience even more difficult.
Yes, certainly. We saw that those with mental health difficulties or those with other sorts of specific needs, it just added to the pressure of being in prison and the inability of services to be able to get into prisons, to be able to support those prisoners, just compounded the challenges that they already faced in an overcrowded and sometimes violent and challenging environment.
And so any disabled prisoner affected by increased isolation would have had a very obvious impact on their mental health.
That was always our concern.
Thank you. May we put back up onto the screen, please, the Inspectorate of Prisons review, what happens to prisoners in a pandemic, and just look briefly at one of the case studies that's contained within this report. And it relates to G. Before the pandemic, G said she had good progress in achieving her sentence plan goals and had been approved for a move to an open prison to serve the last part of her sentence. She was frustrated that this move had been delayed by several months because of the restrictions. She had planned to use her time in an open prison to find work and somewhere to live on release. Although a transfer was ultimately offered to her, it had come too late in her sentence to allow her to benefit from open conditions before her release. And she told the Inspectorate, "I just felt like my world had been turned upside down. I really had a goal in mind from the beginning of my sentence that I wanted to spend the last 2 years in open. Now that slipped by and I was, okay, I'll just do the last year. And when I got my recat, which is a recategorisation decision, I was absolutely over the moon. And then her transfer was postponed. I just felt gutted. I had it in mind that I'd have a job to go out to because I'm dreading, in a way, going out because I've got nothing to go out to. And I knew that going to open prison conditions would give me that bit of help that I needed to build something up." And that was not an isolated example, was it?
No, and the reason why we used case studies like that was because it revealed the deep malaise that we saw growing within prisoners, a sense of helplessness and hopelessness about the future. One of the things that helps people to cope with their time in prison is a sense that they're making progress towards a target or a goal and that they are working their way through their sentence. And you could see this was a case where a woman who had done everything that she was supposed to have done, but was then going to fail to get into open conditions with all the advantages that may have entailed. Although the reality was, even in open prisons, the opportunities for release on temporary licence and going out to work were themselves severely limited.
Yes, thank you. Paragraph 366, you say continuity of care on release for prisoners was also poor during the pandemic. Many were released without adequate support or clear pathways to community mental health services, and waiting lists for community services were long. How was this caused or contributed to by the pandemic, and what should be done to correct that discontinuity in the event of another pandemic?
So what we would want to see is that prisoners who are getting treatment, particularly for mental health conditions, are able in a timely fashion to be able to have their case moved over to community services in order that that treatment can continue. What we saw, and sadly what we continue to see, is often there isn't that continuation of care, and therefore people begin to deteriorate when they come out from prison, with the inevitable consequence that often they then come back inside again without too much of a delay. Yes,
thank you. I'd finally like to ask you about lessons learned, and I appreciate that I haven't provided any warning of this, but I wonder if we could just put up, please, at the end of your witness statement. It's 659848, and to look at pages, I think it's 73 and 74, paragraphs 371. I think it's just over the next page, please. Thank you very much. And can we highlight these 3 paragraphs, please? I'm keeping you on your toes this afternoon. This is what you say. In the event of a future emergency, His Majesty's Inspectorate of Prisons would primarily urge inspected bodies to have a clearer overarching recovery plan. The Inspectorate often found places of detention were too slow and are inconsistent in reversing restrictions imposed as a result of the pandemic. And your 2021 to 2022 annual report, paragraph 94, noted, for example, that there was not enough ambition from some governors or the prison service overall to restart activity. In establishments where leaders made efforts to maintain key services, for example, family support work, and to prioritise relationships, prisoners tended to be to report more positively about their experience. I just want to pause there and to ask you, how well have conditions returned back to how they were before the pandemic? Has there been a complete reversal back to the way in which things were before lockdown?
No, sadly there haven't been. We're still continuing to see. We have, excuse me, we score in 4 areas: safety, respect, purposeful activity, and preparation for release. And our scores in our healthy prison assessment for purposeful activity were always the lowest of our 4 areas that we inspected. But since the pandemic, they have been even lower than historically. And the reason is because of the huge delays with getting activities back up and running. That we continue to see empty workshops, empty classrooms, prisoners locked in their cells for far too long. But even since the pandemic, we're not seeing things returning to how they were beforehand. So, for example, visits being put on at weekends often don't happen. We often see evening association, which traditionally was put on for prisoners who were behaving well. That often doesn't happen. So in far too many jails that we visit, prisoners continue to be locked in their cells for up to 22 hours a day with nothing to do. And in many cases, they are still passing the time by taking one of the many drugs that are currently available within jails.
Why is it, do you think, that regimes haven't improved very much?
I think this in part comes down to a lack of real drive, ambition, and what I've always urged, which is an orientation of the prison service towards purposeful activity, towards giving prisoners the sorts of skills, expertise, knowledge, understanding, so that when they leave jail, they're able to go on, get a job and lead successful lives, to fill in the many gaps that there are within prisoners' development, to be able to support them in that process. And sadly, prisons are orientated towards, understandably, safety and security, but they are not focused on that rehabilitative part of their role, which I think the public would expect.
Thank you. Looking back then to the end of your report at paragraph 372, you say it's important to recognise the specific and varying needs of populations in detention. Whilst command mode is no doubt important at the start of an unprecedented situation, efforts should be made to enable leaders locally to make decisions according to the needs of the populations they hold. So the Inspectorate concluded in its 2021 to 2022 annual report that the national framework imposed for prisons restricted the ability of governors to assess their own risks and determine the type of regime they could deliver and whether there were alternative means of delivering this safely. So really, one size doesn't fit all,
no.
and governors should be entitled and empowered to adapt according to the type of population that they have.
Absolutely, the type of population that they have, the specific aims of the prison, but also the build, the design and the space that's available in different prisons. And what we saw is there were very few opportunities for governors to be able to exercise the kind of flexibility that would have made perfect sense and was a cause of enormous frustration amongst governors and amongst leaders within prisons because they felt constrained by a centre that didn't understand the specific challenges that they faced.
Thank you.
Sorry to interrupt. Can I just ask, Mr. Taylor, I was going to ask you the question about how you embed good practice. So you've given examples of how some governors... Now, if you go to a system you've just described of giving every governor their own discretion and all the rest of it, how then do you make sure that the central body, namely the MOJ, responsible for prisons, embeds good practice around other prisons? Do you follow my question?
Yeah, absolutely. And I think there is a balance between the level of autonomy that you give governors and the level of control that you have within the centre. But I would say amongst prisons during the pandemic and even now, that balance is not right, so that governors are unable to make decisions on some really basic and fundamental things that as a former head teacher would be absolutely expected. And so I think it is out of kilter. And I think it's a source of big frustration for governors. But of course, you need an accountability system so that you make people accountable as well as giving them responsibility. What we find often is that people are accountable, but they're often not responsible for some of the things that go on with their jails. And that's a very big source of complaint and frustration from many of the people who work in prisons.
Thank you.
Thank you. And finally, at paragraph 373, you say the value of constructive and swift independent oversight became very clear during the pandemic. Inspection reports helped to inform policymakers and the public and ensured that detention leaders had critical scrutiny of major decisions affecting the welfare of detainees and prison staff. Independent assessment of institutions is essential in times of crisis. Especially in places of detention which continue to operate largely out of the public eye. And the Inspectorate of Prisons believes in the capacity of both individuals and organisations to change and improve, and that you have a part to play in initiating and encouraging change, be it during a national emergency or otherwise. Mr. Taylor, thank you very much. My lady, there has been permission granted to 3 core participants to ask questions. The first in the list is the Migrants' Rights Consortium, and I think that Ms Moffat is asking the question.
Ms Moffat.
Thank you, and good afternoon, Mr Taylor. Yes, I represent the Migrants' Rights Consortium, which is a group of 9 organisations representing the rights and interests of migrant people in the UK. My question relates to access to legal representation for those in immigration detention. At paragraph 281 of your statement, you say that face-to-face legal advice, you don't necessarily need to turn it up, I'll just summarise it, but face-to-face legal advice surgeries were suspended during the pandemic in IRCs and immigration removal centres. You go on to say that they were still taking place by telephone and by video call. However, securing legal advice by telephone and by video would have required appropriate technology to be provided to immigration detainees, information to be provided in a format and language that they understand, and including, in many cases, the need for interpreters. Is it right that many detainees would have struggled to obtain appropriate legal advice in those conditions?
Yes, certainly. It made life more difficult. I mean, we were and of course, detainees immigration removal centres are allowed to have their own telephones, so they're able to use their own phones to be able to make calls in a way that prisoners aren't. But nevertheless, as you say, the difficulties with things like interpretation services, the inability to be able to have face-to-face contact was certainly an issue. I think the mitigating factors were the fact that they could have phone consultations, but also that the number of detainees in custody was reduced, and that meant that the overall burden on those with immigration issues was less high than it might have been.
Thank you.
Thank you, Ms Moffat. Mr Pisani, I think he's probably behind you and to your right, Mr Taylor, but keep your voice going into the microphone, please.
Good afternoon, Mr Taylor. I ask questions on behalf of Mind, the mental health charity. The context of my question is paragraph 330 of your witness statement, where you cite stigma as an obstacle to disclosure by prisoners of potential mental health needs in the context of individuals seeking to access mental health services for the first time and barriers to that access. So paragraph 330 reads, some prisoners were reluctant to disclose mental health needs due to the associated stigma, and staff did not always have time to build the trust that would support them to disclose this. My question is this. Is the relevance of stigma during the relevant period during the pandemic that first, prisoners who needed mental health treatment may have been overlooked because of that reluctance arising from stigma. Second, that was combined with their isolation from staff or invisibility to staff. And third, whether it was compounded, that inhibition was compounded by a lack of confidentiality in shared cells and on phones in communal areas.
Yes, absolutely. In prisons that are effective, what we see is good quality private screening for prisoners when they come into custody, and also the ability of staff to be able to make referrals if they become concerned about prisoners. But of course, what we saw during the lockdown was that prisoners couldn't get out of their cells, and therefore staff were unable to make the sorts of assessments that they might normally make. So if a prisoner was suffering from a condition that meant they were very actively and very obviously in distress, then they were more likely to get support. But if a prisoner was suffering, for example, from severe depression, the danger was that nobody would pick that up. But also that being in a secure cell, well, it very much, in a doubled up cell, very much depends on your relationship with your cellmate about the extent to which you might want to disclose anything. And for many prisoners, they would be extremely reluctant to show that sort of vulnerability in front of another prisoner.
I'm very grateful. Thank you.
Thank you, Mr Pisani. And now I think it's Miss Douglas, who's probably directly opposite you, Mr Taylor, I think.
Hello, thank you, my lady. Good afternoon, Mr Taylor. I have two questions on behalf of clinically vulnerable families. You agreed earlier that clinically vulnerable prisoners would have been particularly impacted by overcrowding, and you've told us about shielding units and various cohorting methods that were used to varying degrees. Do you know whether prisons were conducting risk assessments looking at the particular impacts on clinically vulnerable prisoners?
We didn't come across that as a generalised thing that was going on, but we do highlight, for example, what we saw in HMP Bristol, where there was some real thinking being done. But I would say overall it wasn't something that we found or reported on.
And may I just clarify, Ms Taylor, is that something are you saying that may have been going on, but it wasn't brought to your attention, or you have found no examples?
It wasn't something that we saw.
Okay, thank you. The second question is in relation to detainees surveys, and at paragraph 79 of your statement, you've described the abridged versions of these surveys that were conducted in relation to scrutiny visits between July 2020 and April 2021. You've described that the surveys at that time covered topics including COVID-19 restrictions, and also demographic and background questions to enable responses from different subgroups of the prisoner population to be compared. I note in the copy of the survey, example of the survey that you've exhibited, question 18 asks if the respondent has a disability or a mental health problem. Given that the surveys were being conducted during the pandemic, do you think it would have been helpful to also collect data as to whether a prisoner had an underlying health condition or was otherwise clinically vulnerable in order to better understand the impact of the pandemic on them?
I think, yes, indeed. And there were lots of things from our long survey that we couldn't include within our shorter surveys that we conducted during the scrutiny visits. And really, that was the precautionary principle, that we wanted our surveys to be as light touch as possible and our burden on the prison to be as little as possible. And therefore, we had to make some compromises about what we took out of our normal survey, which is a much longer and much more extensive document. And I think it's fair to say, both in the area you describe and in other areas, we didn't have the breadth of detail that we normally have. So it was a compromise we had to make in order to fulfil our agreement with the prison service and to keep staff, prisoners and our researchers safe.
Thank you, Mr. Taylor.
Thank you, Ms Douglas. That completes the questions we have for you, Mr Taylor. Having visited a few prisons over my time, I don't envy you and your colleagues your task. Thank you very much indeed for your help with the inquiry, both in providing the written statement and your evidence today. Thank you.
Thank you, my lady.
Thank you. My lady, the next witness is ready to come in. Yep. It's Helen Milner from the Good Things Foundation. And I'm told by my learned friend, Miss Rahman, that her evidence will be about half an hour. So is my lady content to carry on?
We'll go on.
Yes, thank you very much.
Ms Rahman.
Can the witness be sworn, please?
Okay. If you'd like to repeat after me. I do solemnly, sincerely and truly declare and affirm
sincerely and truly declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
nothing but the truth.
Sit down.
Ms Milner, thank you very much for attending to give evidence today. Could you give your full name, please?
I'm Helen Louise Milner.
Thank you. Ms Milner, there should be a statement in front of you dated 24th September 2025, INQ 000655897. Can you confirm that that is a statement that you have provided for the purposes of the inquiry?
It is.
And can you confirm that any facts stated within the statement are true to the best of your knowledge and belief?
They are.
Thank you. Ms Milner, starting first with what you say at paragraphs 1.1 to 1.4 of your statement. In summary, you founded the Good Things Foundation in 2011.
That's correct, yep.
And it's the largest digital inclusion charity in the UK, is that right?
That's correct, yep.
And you say that the mission of Good Things Foundation is to fix the digital divide, and you explain that's ensuring that everyone can participate in a digital society.
That's correct.
As part of that, you say that you focus on supporting people who are economically and socially disadvantaged. We'll come back to that in more detail, but in summary, is that because people in those categories are more likely to be digitally excluded?
Absolutely. Of the millions of people in the UK who are digitally excluded, they broadly fall into two main groups. They are either older or they're economically disadvantaged, and there's a huge overlap. So actually people who are older and economically disadvantaged and therefore socially disadvantaged are a large group of those people who are digitally excluded.
Thank you. And you note that even before the pandemic, society was increasingly reliant on digital tools, digital services. The work that you do was particularly important for that reason.
Absolutely. Up until the pandemic, public services being digitised, coming online, private companies coming online. And I would say that probably most people in this room were fairly reliant on digital services before the pandemic and obviously since then.
In terms of reaching people who weren't able to do that, at paragraph 1.4, you've described how you worked in partnership with thousands of hyperlocal organisations. Can you give us an example or some examples of what hyperlocal organisations are?
Yeah, so ever since we began in 2011, we've always worked in partnership with I call them community partners or digital inclusion hubs. So these are organisations at a local level, community organisations, community groups, local charities who may specialise in helping, say, migrants and asylum seekers or older people, people who are seeking work, faith organisations, local branches of things like Age UK. There are also private sector organisations like some banks, Virgin Money, for example, mobile phone shops, O2 mobile phone shops. So it is absolutely a public, private and third sector. But the key point is they are in communities where people are. They already are engaging with people who are socially and economically disadvantaged and therefore may also be digitally excluded, and that people can go there and that they can get support and help for the many barriers that they might be experiencing from a digital exclusion point of view.
Thank you. And you've described the name of the organisation. It's the National Digital Inclusion Network, and that's describing those sorts of organisations that you worked with before the pandemic and continue to work
Absolutely. And there's thousands of them now. Actually, there's over 8,000. I think during the pandemic, there were probably around 5,000. So they are actually in all of our communities. So they're often invisible to you, but they are there working terribly hard with all of those people and are very much there to respond to the needs of either the specific group that they're supporting or that local community as a kind of community hub.
Thank you. And you explained there are two core services that you offer, National Data Bank and National Device Bank. Could you just summarise for us what those two services are?
So the main barriers for people who are digitally excluded are either they don't have the access because they can't afford it, or they don't have the ability or confidence or skills to be able to use the internet. So on the former, on the access, we work in partnership to provide the National Data Bank. So that is providing people with free SIMs, so mobile phone SIMs. So the same day they can get access to the internet. This is for people who cannot afford even a £10 top-up. So these are people in our society today who are very excluded and who need to be online to, for example, to talk to the Home Office about their asylum claim, for example. So that's a National Data Bank, and we now have over 3,000 of those, like food banks, but for mobile phone data. And the National Device Bank is where we work with the private and the public sector, so large employers who give us their tech, their computers, their laptops, their mobile phones, and then we work with a third party to refurbish those and through the National Digital Inclusion Network provide those devices to people who, again, don't have them because they can't afford them.
Thank you very much. And you also describe digital hubs which are working in the community, people coming in for training. I presume that those are sort of physical locations, is that correct?
They are the hyperlocal organisations. Sorry for using lots of different language.
No,
we call them digital inclusion hubs to kind of try and give them a nice collective name.
Yes.
But they are all independent from us. They're all mostly independent from each other. But people can go there and get help with their digital inclusion.
I touch on that because when we now come to the impact during the pandemic, which you deal with in your statement from paragraphs 1.5 to 1.7, the first impact that you describe is your partners having to close their doors. So you're describing some physical location that had to close.
Absolutely. So people who, for example, don't have devices or couldn't afford devices or connectivity, up until the pandemic, would often go to the Digital Inclusion Hub for support with that confidence and skills. They might want some help to fill in an online form, but actually they could access the internet from those physical places. But of course, as soon as lockdown happened, they had nowhere to go. And I heard from local community partners that, for example, people were standing outside to use their Wi-Fi, for example. So literally standing outside, you know, in the rain, in the cold, to be able to use the free Wi-Fi that previously they'd been able to go in and actually sit on the chairs and the tables and maybe have a cup of coffee whilst they were using their Wi-Fi.
So, whereas many people in society had moved on from the days of going to, for instance, an internet cafe, what you're describing is an element, a significant number of people who, when the pandemic started, were left essentially locked out.
Absolutely, and I think that that was a big shift. So I have worked in digital inclusion for a long time and clearly founded Good Things Foundation in 2011, so almost a decade before the pandemic started. And that aspect of digital exclusion was quite hidden before the pandemic because there were places that people could go. So once the pandemic hit and we all realised how incredibly dependent we were, not just on our daily lives, but actually during a crisis, during a pandemic, that to use the internet in order to get the help and the services that you needed, that we, from then on, I and Good Things Foundation believe that it's a fundamental right for people to be able to have a personal device and be able to afford a connection to the internet themselves. So it's not good enough to be able to go to a place. Going to a place is great. You get lots of support, lots of holistic other support, but we believe that everybody should be able to have and afford a device and connectivity.
Just looking again at why the pandemic exposed something that was hidden, is it because when that happened, it seemed to be the primary way of accessing help, support, services and information, which people needed to do online, essentially?
Absolutely. So there's sort of two parts of this. One is that obviously the charities like Good Things Foundation were the largest in the UK, but others working to support people to remove those barriers. But the other thing that happened in the pandemic was there was an assumption by a lot of people who were providing the support that people were online. So, for example, the first letter that went to people to instruct them to shield had 9 separate URLs to help to instruct people where they could get help. And so a large number of those people would have been older and poorer who actually would not have had any wherewithal to be able to go to those URLs. At the beginning of the pandemic, you couldn't get a COVID test, you couldn't book a COVID test, you couldn't, and then when the vaccines came in, you couldn't book a vaccine unless you had an email address. So we were actually building solutions to support people with the pandemic, with the crisis response, but we were actually putting those online. So there was the misunderstanding by a lot of the people who were designing those systems that actually everybody was online. So it wasn't just that there was an understanding that it was just a majority, because there was no actual thought about how do we help those people who weren't online.
So essentially, we're moving on to how you helped those people. You describe in your statement doing things such as working with partners to get refurbished laptops, for instance, to people who needed it from businesses.
We did. Actually, during the pandemic, we also were out there looking for money because getting refurbished devices took a long time and we wanted to help people very quickly. So we actually were lucky and we got money from, for example, Barclays Bank, from the National Lottery. We were given new phones from Google. So we were actually looking for money to buy devices. So the majority of the devices during the pandemic were new, that we got grant money that we could then buy and distribute through the National Digital Inclusion Network. We did also begin the recycling process, but actually that is a much longer process and didn't seem to really meet our needs when we were doing it in a crisis response mode.
Thank you. And in terms of the sorts of people who needed the support that you described, starting at paragraph 1.7, you talk about, in particular, those with learning disabilities, older people, as you've mentioned before, and also families who needed devices in particular to support their children's learning and their own learning. Were they the sorts of people you would describe as being particularly impacted in terms of access to technology during the pandemic?
Yes, I mean, I want to say it's important that we hold tight the generic point about people in poverty and people who are older. So that I think that within the people in poverty, people with learning disabilities and the families that needed support would both be subgroups within that.
Yes.
They would be people who were suffering because their circumstances, or for example, their learning disability meant that they weren't in well-paid jobs, for example. And older people, because older people haven't used the internet or computers at work to a degree, or they haven't been able to be learning in a job, that they are also a group who are digitally excluded. So that's why we focused on those specific groups.
I'll have some questions for you about some other groups later on, which you can help us with if you're able to. I'll just come to those in a moment. Just before I do, though, at paragraphs 2.2 and 2.3, you describe some of the innovative ways in which people were helped to access culture, community life, and faith-based activities. Could you just summarise in a sentence or two some of those activities?
Absolutely. So we, during the 18 months of the first, from the beginning of the pandemic for about 18 months, we did actually distribute over 22,000 devices. And so obviously we had to get those to people whilst also recognising that people needed to shield and social distancing. And so community partners were very innovative about leaving on somebody's doorstep and like staying 1.5 meters away and then having a chat, making sure they downloaded Zoom, for example, onto a tablet, and then to social distance, help them to load the Zoom up and then actually support them over Zoom. That actually, once you're allowed to spend, to stand 1.5 meters away from somebody, people, some of the community partners rented like a community hall and spaced out all the tables so they could still get people together and to support them in that way. That there were a lot of digital champions, so volunteers, and we also heard from some of our community partners in rural areas who actually literally had these laptops and tablets in their cars and were driving hundreds of miles around the country to make sure the people in rural locations were also supported during the pandemic. So the kind of combination of helping people to move online at the pace that they were comfortable with and in innovative ways, combined with actually making sure that people were sticking to the rules, but also able to help them face-to-face just a little bit further away from each other.
Thank you. You mentioned there helping people to use Zoom, and widespread technology, a use of technology like that was perhaps a really memorable part of the pandemic. The fact that that was suddenly being used in workplaces, socially, at such an unprecedented level, would it be fair to say that's an example of how technology can be used to level the playing field and lessen inequalities? Because everybody is essentially using the same bits of kit, it seems.
Some work that we do, so at Good Things Foundation, we work with community partners from a delivery point of view, removing barriers, but we also work in research and evidence base to understand the data, but also to understand the barriers and therefore can create solutions. And one of the things that the team have developed is something called a minimum digital living standard. So to understand what the baseline is. The reason I say that is because what happened during the pandemic was we were hearing often that businesses were digitising services that they had planned to do over 3 years, and they were doing it in 3 weeks. And so we had that the people who were already online took leaps forward. So although I don't disagree with you, and that our job is about digital inclusion. We're about solving exclusion, to bring people into the digital world. So based on their choice of what it is that they want to use, that they're then able to be in that level playing field. But I would say we're still moving people up to a minimum.
You've got to get them on the first rung of the ladder before they can do that.
Absolutely. And I think during the pandemic, some people went up that ladder very quickly, and lots of people were still helping to get to that first rung of the ladder.
You mentioned the businesses who were planning to do things in 3 years, but did it in 3 weeks. Going back to the people who were helped who were older, would it be fair to say that some of those people, out of necessity, had to get online, and perhaps they did that quicker, or perhaps they wouldn't have done that? What do you think is the situation there? Do you think older people have in fact become more or less digitally excluded as a result of necessity during the experience of the pandemic?
I think it's definitely true to say that either through necessity or choice. So, for example, some older people that we spoke with didn't think it was for them. They thought this was something they could ignore. And then actually, because of the pandemic and the opportunities for them to, for example, communicate with friends and family much more easily was available. But then also, I would say, because of things that organisations like ourselves and others were doing, to say there are people excluded in our communities, we must find them and we must support them. So actually, I definitely think that there were people who were supported to be able to use the internet to get a device and connectivity wouldn't have been helped during that period of time if there hadn't been a pandemic. So I think that's definitely true.
Thank you. I want to move on now to particular groups that you mention in your statement. Now, the inquiry's heard a lot of evidence from many sources about how the pandemic exposed and exacerbated inequalities. And I want to ask you about some specific groups. So you've already emphasised, and in particular at paragraph 2.7, that digital exclusion is most closely aligned with financial poverty. We've already covered that was a pre-existing issue. Essentially, the pandemic has brought it into sharp focus. You've described a couple of issues, people not being able to afford essentially to get online, and perhaps not being able to afford a device as well. But you also mention in your statement issues such as having older devices. Is that another of the issues that
Absolutely.
simply weren't fit for the purpose?
That a good example of this is that the first app that was developed you could only use on a relatively new phone. So actually people might have had a smartphone, but because they couldn't afford to update it, they were still operating with an older phone, which actually met their needs. But though the app was then designed for a phone that was better than that. So there is none of these things are binary, are they? Is that some people had nothing and had never used the internet. Some people had a phone, but it was very old. Some people had a phone, but they couldn't afford the connectivity. Some people had a phone and could afford the connectivity, but didn't know how to use it, didn't know what an app was, hardly ever used it at all, had it in a handbag or a drawer to turn on for an emergency. And so that when we talk about digital exclusion, we are making sure that we're finding solutions for all of these people wherever they sit on that continuum.
Thank you. We heard yesterday about the work of local councils to keep libraries and community spaces open, and you mentioned that at paragraph 4.3. You say that people were affected by those sorts of closures because they were relying upon those spaces to get online. Thank you. I've been asked to clarify with you some specific groups. At paragraph 4.2, you mentioned that 10% of your network partners are located in communities where over 50% of the population is BAME, and they experience the effects of digital exclusion. I take it you mean by that both before and during the pandemic.
Absolutely. And in my statement, I've got a quote here from one of our community partners that I think this also shows that because they are helping people in a holistic way, including digital exclusion, the community partner says here that that actually because English wasn't their first language, they sometimes saw that COVID-19 protocols weren't fully understood. And so they were helping them to explain those protocols. And they also talked about mental health being an issue. So I think it's important to say that this is a complex set of issues, and digital exclusion is one of those sets of issues. But that's...
Indeed. We have heard as well from specific experts in relation to these issues across the board in different sorts of interlocking or overlapping inequalities.
Yeah. And so that, for me, that's why the National Digital Inclusion Network is so incredibly important, because they're meeting people where they are. So these network partners will also be speaking those community languages because they are from that community.
Yes.
And so that's so incredibly important as well.
In that same paragraph, you have mentioned refugees, and again, it's a question I've been asked to clarify with you. Would you agree that migrants and asylum seekers are amongst those likely to be digitally excluded?
Yes, and they do form a large portion of who we see through the network.
Thank you. Moving to another point, at paragraph 2.6, you talk about unequal impact depending on where people lived. And you say in 2020, some research suggested that in England, whilst 49% of people in the southeast were able to use the internet fully, just 31% in the northwest were able to do so, and 18% in the northeast, according to that research. Would it follow then that you would say that during the pandemic, rural communities were particularly affected by digital exclusion?
Absolutely. Rural communities, specifically because the lack of transport, a lot of the transport wasn't available. So if you have a low income and you live in a rural area and there's no buses, then you definitely are incredibly excluded and you're not online. I think that those stats are very important and useful. I always say take it with some caution,
of course,
because everywhere there are pockets of deprivation. And so and there are very large numbers of people who live in the southeast, and some of whom would be living in deprivation and have low incomes. So I think it's helpful to target activity and to target solutions, but I think it would be wrong to therefore say that there's not pockets of deprivation everywhere, rural and urban.
You mentioned there was a need for flexible solutions in terms of the lack of transport and the difficulties in particular in rural areas. Are you aware of any such solutions that were deployed during the pandemic to address the issue?
Well, the one that I mentioned where the community partners literally got in their cars and drove to help people in obviously within the rules of the pandemic. So that's the only one that I know of.
Thank you. Moving on to disabled people, that group is listed at paragraph, included in a list at paragraph 2.8.3. And at paragraph 4.7, you also describe a project that was focused on those with learning disabilities. More generally, I'm asked to clarify this with you. Is it the case that disabled people were particularly impacted by digital exclusion during the pandemic in terms of barriers to accessing information, advice, services and healthcare?
I'm going to say yes, but I want to put a caveat because, again, it's the main driver is income. Large numbers of people who are disabled are not in work or not in well-paid work. So people who are disabled and in well-paid work were not affected as badly. And I think it's really important to understand the intersectionality between disability and poverty.
Yep, thank you. The inquiry's also heard evidence, and I believe you were sent some of this as well, about the impact of the pandemic on victim survivors of domestic abuse. Would you agree that they were impacted by digital exclusion, particularly older women and those without recourse to public funds?
I have read the evidence, and we also do work with small local charities who support victim survivors of domestic abuse. So they were definitely impacted. The other thing I wanted to pull out from their evidence that I read is also something that we absolutely saw across a range of smaller charities, that their staff as well often could not afford devices and connectivity, or they didn't have the skills to use things. We've talked about Zoom. And so this suggestion that everyone could just go online and provide their support online didn't just affect the people, the beneficiaries of those charities, it also affected the staff who were often volunteers or in low-paid work and actually couldn't afford or have the skills themselves.
Thank you. The inquiry's also heard accounts of major disruption to the justice system. Again, I believe you've received some extracts from a roundtable report on that. What was described was victims being unfamiliar with online processes, again, not having sufficient data or reliable internet connection in order to participate in hearings. Is that anything that you encountered in your work?
So not specific around access to the justice system, but generally, obviously, yes. That we came across a lot of people who were excluded from all kinds of things that they needed to do in their lives because of lack of reliable broadband or lack of connectivity because they couldn't afford it, or not having a device or a good enough device. And I would also say, and I think an assumption from people providing public services, that people could just do that.
Yes.
So a lack of understanding that there are people who don't have devices, can't afford connectivity, don't have the skills, but also don't have the agency, don't have somebody in their social group who can help them. There was an absolute lack of understanding. That was one of the things that we felt coming back from the National Digital Inclusion Network frequently, that there was this frustration, not only that people didn't have what they needed from a digital inclusion point of view, but actually there was a real lack of understanding from the people providing the services. Of course, not all the time, but that was something that we heard back from the network.
Thank you. And finally, in relation to specific groups, at paragraph 4.8, you mentioned bereaved groups. I think you were asked about it. But you say you didn't do any specific work to support them, but you did hear that some of the free devices you provided had been used by people, for instance, with relatives in hospitals or care homes. So potentially that did help.
Absolutely. And we heard also back from hospitals who were aware that loved ones were able to contact people in hospital because they had a device through the schemes that we had run.
Now, I want to, just in closing, finally, touch on what you say at section 3 of your statement. Essentially, you were asked about key workers, and whilst you say that there was a massive increase in people accessing your courses for work, you don't have any specific data on key workers. They may have been key workers, but you don't know.
Yes, exactly. We know people in work came and used our services, which was and was new at that level, those numbers, but we don't know if they were key workers.
Thank you very much, Ms Milner. You have set out at the end of your statement a large number of lessons learned. Drawing it together, is it fair to say that you've described the pandemic having a significant impact on those who are digitally excluded, and all of that essentially underlines the importance of your mission, which is to tackle digital exclusion and promote digital inclusion?
I would, absolutely, and that the job isn't done yet. That one reason why I quite like working in digital inclusion, I believe we can fix the digital divide. We can make sure that people have affordable devices, and the refurbishing schemes prove that, and that they can have affordable broadband. And obviously with the support of the thousands of amazing community organisations in communities, they can have that support that they need to get the skills and the agency. Just one other thing I would say, one other aspect, is that the way in which decision makers, people building apps, people deciding how to provide support was instantly online, because often some of the data that those decision makers are provided absolutely does not show the complexity of the picture. So if it says, has somebody accessed the internet in the last 3 months, and they say yes, then it doesn't mean that they've got a device that can use that app, or they know how to download an app. And so I do think that that the decision makers weren't aware of digital exclusion. So the pandemic exposed and also exacerbated digital exclusion, but I'm not convinced So things have got better, but I'm not convinced that people making similar decisions now would not make the same decisions and would forget about the millions of people that we were helping and that became exposed to us during the pandemic.
You've described how the digitally excluded tend to belong to groups in society who are vulnerable. And so in helping, for instance, an older person or a young family living in poverty to get online, would you say it's possible to lessen the adverse impacts in different ways? And you've described from simple things like being able to book a COVID test to broader issues like reducing social isolation.
Absolutely, absolutely. It's a fundamental building block for people to be part of society. I mean, obviously to use public services, but to get a job, to get a better job, to get a better paid job, for parents to be able to not just for their children to do their homework, but also for parents to understand their homework, to communicate with their schools. That it's a fundamental within our society that I think often lies. Most people are very unaware that there are so many people who are not functioning because of poverty and a lack of opportunity in a way that most of us expect the general population in the UK to be functioning.
Thank you. And finally, you, like many others, have emphasised that collaboration with cross-sector partners such as charities, councils, businesses is extremely important in promoting digital inclusion.
Absolutely. And just to say a positive thing from the pandemic, because of that emergency response, there were a lot more businesses, a lot more community organisations and charities willing to quickly break through the bureaucracy and collaborate and work together to make sure that we did provide that help as quickly as we could to the people who needed it.
Thank you very much, Ms Milner. My lady, those are all my questions, and there aren't any from core participants unless you had any further questions.
No, thank you very much, Ms Rowan. Ms Milner, you've described as being on a mission, a very worthwhile mission, if I may say so. I see from the Foundation's website you're planning to retire this year. I'm going to make a guess you're going to be as bad at retirement as I am, given the importance of your mission. So I wish you well in your retirement, and thank you for all you've done to try and help people, as you say, who have desperately needed it at all times, but particularly in the pandemic. So thank you very much indeed.
Thank you so much.
Very well, that completes, I think, the evidence for this week, Ms Roman.
Correct. And my lady, yes, we start again on Monday at 10:30.
Yeah, Monday the 2nd of March at 10:30, and I shall be attending in person next week for the last week of our hearings. Not just of this module, but of the inquiry. Thank you very much indeed.
Thank you.